Assalamu alaikum, doctor.
Assalamu alaikum. Yes, Faria. Hello.
Assalamu alaikum, doctor.
Wa alaikum assalam. How are you?
I'm good. How are you, doctor?
Alhamdulillah. I'm very fine. All set?
Yes, doctor.
So just tell me when the students are ready so that we can start.
Doctor, the students are ready. We can start.
Are they ready? Okay.
Yes.
Okay. So, A'udhu Billahi Minash Shaitani Rajim. Bismillahir Rahmanir Rahim. Assalamu alaikum. So, how are you, my dear students? This is our first interaction in the second year. So, I'll be teaching you histology of the male reproductive system. I expect few things from you. Scheme remains the same, like most of the systems of the body. Male reproductive system also consists of organs, most of which are like tube, so they are tubular. So it's easy.
Doctor,
it's not difficult. Yes. Any problem?
Doctor, we can't see your screen. So it was sharing before, but now it's gone. If you could try to reshare it. It's just a black screen right now. I think as you move it to presentation mode, it sort of went away.
This one?
Yeah.
This one?
So if you can close the presentation mode and restart it.
Okay, stop sharing and restart, okay?
Okay, yes, sure.
So I stop. Now reshare?
Yes, doctor.
Okay, and this is...
Yes, we can see the screen, doctor. Doctor, I think the problem is that when you have animations, the screen is black until you keep pressing.
I don't have any animation. They are just PowerPoint slides. I don't know what's happening. Wait.
Oh, your first two slides, it shows our animation.
Okay, so I will skip those slides. Don't worry.
Okay, doctor.
What's happening?
You can continue as you were, doctor.
But I want to... Wait. Just wait.
Yes, doctor.
Wait. I don't know what's happening.
Yes, doctor, we can see the slides now.
It's okay now?
Yes, doctor.
Okay, so now I just started. What I was saying is that the male reproductive system, like other tubular systems of the body, consists of organs, and most of these organs are tubular in structure. So if you remember our first year histology, semester 1 and semester 2, especially in semester 2, when I was explaining you the GIT, so I think it was a very good system, and I explained you in a nice way. Now, I'll start properly. The male reproductive system consists of testes, the male gonads, and there is a system of ducts which starts from the testes, and it consists of efferent ductus, epididymis, vas deferens, ejaculatory ducts. We will see all these ducts and we will cut them transversely to see their histology. And then there are two exocrine glands associated with the male reproductive system, prostate and pair of seminal vesicles, which are present on the posterior surface of the urinary bladder. And of course, penis, the organ of copulation. All these are shown in this diagram. So we'll start with the testes. Testes, look at this. It's a very simple diagram. This is a section of the testes. So you need to know the side in which it has been cut. So here, where my this laser pointer is, this is the anterior side of the testis. You can say the anterior border. This side is posterior. This side is the upper pole. This side is the lower pole. So it has been cut like sagittally, you can say. So testis is this organ. So we'll start from outside. When the testes they descend from abdominal cavity and they come to lie in the scrotum, they carry with them, they drag with them layers of peritoneum. So when they surround the testes in the scrotum, these two layers can be seen, these two blue ones, the outer layer and the inner layer. The two layers collectively form a capsule which is called as tunica vaginalis. This tunica vaginalis consists of two layers, an outer layer and an inner layer. Outer is called as parietal, inner one is called as visceral, and at the pole of the testes, the two layers are continuous with each other. There is the potential space between the two layers, and there is a small amount of lubricating serous fluid which is secreted by the mesothelium lining the two layers. So these two layers they provide a covering for the testes within the pouch of a skin scrotum. The two layers together are called as tunica vaginalis. Now, then comes the actual capsule of the testis, the white, tough capsule, which is made up of thick connective tissue. This capsule of the testis is called as tunica albuginea. Tunica means a layer, albuginea means a white. It is made up of dense connective tissue. Now, this connective tissue, which surrounds the testis completely from the posterior side, it gives into the substance of the testis these white connective tissue septa, which are nothing but the invaginations like this. Now, these invaginations are called as septa or septi in plural. They divide the interior of the testes into small compartment. Each compartment is called as a lobule. So we have approximately 250 such lobules within the interior of the testis. So if a testis is cut anterior-posterior or from lateral to lateral side, we will see that there are compartments. Each compartment is called as a lobule. The boundaries of the lobules are formed by these connective tissue septi, which are continuous with the thick white connective tissue capsule. The innermost layer of this capsule, the innermost layer of the same connective tissue capsule is richly vascular. There are more blood vessels present on the inner, or you can say the deep aspect of this tunica albuginea. Sometimes it is considered as a third capsule because of the vascularity. It is called as tunica vasculosa. So now, what do we have in the testis? We have lobules, we have septi, we have a capsule. Now, in each lobule, in each compartment, there are horseshoe shaped tubules. Like their lower side is like a loop, but their upper end become continuous with these straight tubules. So each tubule, which is highly coiled, is actually horseshoe shaped. Each tubule is called as seminiferous tubule, and there are about 1 to 4 such tubules in each compartment. I repeat, in each compartment or lobe, there are about 1 or 2 to 4 these tubules, which are like horseshoe shaped and they are highly convoluted. They are called as seminiferous tubules. These are the tubules which are our actual concern. Now, as we go up toward the upper and the posterior aspect of the testis, the posterior superior pole, this all area, the white or grayish hair, this is called as mediastinum testis. Mediastinum testis is the area present near the upper pole on the posterior side. So first of all, what we see that these seminiferous tubules become straight tubules. They are called as straight tubules or tubuli recti. They enter into a network of tubule. This network of the tubule, which is receiving the product of the seminiferous tubule, this network is called as retitestis. From the retitestis, once again, around 15 to 20 tubules, but they are this time larger. They arise and they pierce the white, thick tunica albuginea to enter into this very important tubule, which is called as epididymis. So these tubules which pass out of the testis, by making holes, by piercing the tunica albuginea, they are called as ductuli efferentes. So they are all different names, and we will see their histology. Then comes this site of maturation of the spermatozoa. This is called as the epididymis. Epididymis has head, body, and the tail. So it's a gross description. I'll not go into the detail now. I'll cut testis in any section so that we can see the structure of a seminiferous tubule. Look at this testis. When we cut it and see macroscopically without staining it and processing it, what can be seen? A dense tunica albuginea. You can see here, it can be seen. It contains, yes, now because it's a connective tissue capsule, so fibroblasts are there. There are some additional features. We can see abundant myofibroblasts. So these are actually the fibroblasts, which are the cells of the connective tissue, but they develop the ability, the contractile ability. So they are called as myofibroblasts. Plus, the original, the smooth muscle cells are also present, particularly in the posterior part of the testis, and the contraction of all these ultimately results in the rhythmic contraction of the seminiferous tubules. Now this you will understand later on, but I have mentioned here scattered Leydig cells. Leydig cells are hormone secreting cells. These are the cells which are responsible for the secretion of testosterone. They have a specific location, they have a specific structure. But here I just mentioned that in the connective tissue capsule, which is the connective tissue, scattered maybe here and there in different places, Leydig cells can also be seen. Now, see, this is a typical light microscopic section of a testis, a section of the testis showing so many seminiferous tubules. Now, apply the same basic information. These are all tubules you can see cut in various planes of the section. What can be seen in the center is the light area. This is considered as lumen. Okay. Then the first tissue that can be seen from the surface is epithelium. Of course, all these cells rest on the basement membrane. Then it's a low magnification, remember. Under the epithelium will be maybe lamina propria. And then this space between the tubule, because tubule are like tightly coiled, convoluted. So there is not much space between the tubule, but still we can see some space. So the main feature of the transfer section of a testis is that you will see a large number of sections of seminiferous tubules. And in the space between the tubules, which is called as interstitial space, we will see some maybe connective tissue and different type of cells. Remember, lumen, epithelium, lamina propria, and then other layers. So see, each tubule consists of following layers. Epithelium, and in bracket I have written special for you. The reason I will explain. It is stratified, full stop. Like see, this epithelium is classified as stratified epithelium. Remember, testis consisting of seminiferous tubule. Seminiferous tubules are lined by this epithelium, which is like a very special or highly specialized epithelium because it consists of the spermatogonia and the series of dividing cells, collectively called as cells of spermatogenic series. Ultimately, the gametes are produced here. So this epithelium is not classified in the way the other type of epithelium, like maybe in GIT, in urinary tract, or elsewhere, were classified. Still, some books, they mention that it's a stratified epithelium, To be more specific, it is classified as stratified cuboidal epithelium. There are two types of cells in this epithelium. We will see the second tissue layer is lamina propria.